night, Trinidad and Tobago. I am Elena Aaron, reporting live from San Fernando, and this is TV8 News. On tonight's Health Watch segment, we will be discussing a common condition that is critical in Trinidad and Tobago, nephrolithiasis. Now, this condition may otherwise be known as kidney stones. I would now hand you over to Letitia Robertson, who would give us an overview of the theory and by extension theorists that nurses in our healthcare sector utilize to combat this condition.
Thank you, Elena. Hildegard Peplau was born September 1909 in Pennsylvania to the parents of German descent, Gustav and Ottilie Peplau. She was the second of 5 children, including a sister and 3 brothers. It was during the 1918 flu epidemic that she developed an influential understanding of the notable impact of illness and death on families. She went on to pursue nursing, graduating from Pottstown, Pennsylvania School of Nursing in 1931. She further went on to complete a master's degree and eventually her doctoral degree in psychology at other institutions respectively. She worked as a practical nurse for 50 years before retiring from Rutgers University in 1974 and died in March 1999. She was dubbed the Mother of Psychiatric Nursing, in addition to the various accolades and honorary awards accredited to her. Throughout her career, she was involved in various official nursing committees as well as acting in part as a consultant to other health governing bodies, including the World Health Organization, the U.S. Air Force, and the American Nursing Association. Peplau's theory of interpersonal relations was first published in 1952 and went on to be established as a functional basis for practice and implemented in psychiatric nursing in 1968.
Peplau's interpersonal relations theory accentuates the nursing-client relationship as the foundation of nursing practice. Peplau went on to form an interpersonal model, emphasizing the need for the partnership between the nurse and the client. This theory encompasses 4 components: person, environment, health, and nursing. This model also identifies 4 sequential phases in the interpersonal relationship: orientation, identification, exploitation, and resolution. In addition to these facets that this framework is structured on, it identifies 7 nursing roles: the stranger role, the resource role, the teaching role, the counseling role, the surrogate role, the active leadership role, and the technical expert role. Sources postulate that there are 3 major assumptions attached to this theoretical framework. The first assumption explores the correlation between the training and the attitude developed by the nurse and its impact on the patient's learning during nursing care. The second assumption considers the key role undertaken by the nurse, especially when nursing education is concerned, is geared towards stimulating maturity. And lastly, the third assumption describes the nursing profession as one that is legally responsible for the appropriate care and outcome of the patient. Now to Amritsar with the relevance and application of the theory.
Thank you, Letitia. The interpersonal processes and therapeutic relationship that develops between the nurse and the client are central to Peplau's nursing model. The first stage in providing nursing care, inclusive of data collection and analysis. The assessment considers not only psychological parameters, but also mental, social, spiritual, economic, and lifestyle elements, all which would assist in determining the root of ailments. In relation to this scenario, both subjective as well as objective data were obtained. The patient also expressed his concern for the economic well-being of his family if he was to consent to the procedure. This all ties into the first phase of Peplau's theory of interpersonal relations. Although brief, within the orientation period, hospitalized patients understand that they require assistance and strive to accomplish to their present and frequently unfamiliar circumstances. The nurses learn important information about patients as individuals with distinct needs and goals at the same time. Since this is the first nurse-patient encounter, the nurse's decomposition sets the tone for the relationship. Going forward, patients and nurses move fast through this stage, and nurses must maintain kindness and respect throughout the stages. This would foster an environment where the patient feels comfortable to share what may be critical information that may lead to an accurate diagnosis. In relation to Peplau's theory of interpersonal relations, the identification step is the second phase, which comprises of a professional's selection of suitable support. During this stage, the patient tends to feel like he or she belongs and is equipped to cope with the condition, which reduces feelings of helplessness and despair. The role of a nurse expands along many phases, and one of most significant aspects of nursing is the holistic care of patients, which includes reassuring the patient. The nurse's job is the implementing phase is to carry out the plan of action that has been chosen. This strategy is tailored to each patient's needs and focuses on attainable goals. Observing the clients for signs of progress or improvement, directly caring for the clients, or conducting critical medical function. Educating and advising the patient about further health management and referring or contacting the client for follow-up are all actions included in the nursing care plan. Phase 3 of Peplau's theory can be applied to this stage of the nursing process. Professional aid is used in the exploitation phase to find problem-solving solutions. The benefits of the professional services provided are dependent on the patient's demands and interests. For instance, in the case, a social worker can be contacted with the hope to aid his family during the time of his treatment and recovery. Once the nurse maintains an environment that encourages autonomy, the patient may make modest demands or utilize attention-getting strategies during the exploitation phase, since he plays a vital role in his plan of care. This phase involves out the nursing plan and taking steps towards achieving the objectives set out in the identification phase. Peplau's final phase of her theory, the resolution phase, can be implemented in the evaluation stage of the nursing process. Once all patients' symptoms are reduced, he attains medical and nursing treatment and he is ready for discharge. It is the end of the professional relationship, since the patient's requirements have been satisfied through patient-nurse partnership. Both parties must end their connection and the ties that bind them as a result of achieving a healthy emotional equilibrium. I would now like to hand you over to Vashti.
Thank you, Amrita. In tonight's Health Watch, we will be discussing the pathophysiology of nephrolithiasis. Nephrolithiasis, also known as renal calculi or kidney stones, involves the formation of renal stones or accumulation and growth of crystals due to physiochemical alteration and supersaturation of urine. Solutes precipitate in the urine in the presence of supersaturation, therefore resulting in nucleation and crystal concretion. This transition of a liquid to a solid is influenced by pH and specific concentration of surplus substances. Low fluid intake is the sole most critical factor of stone development. The authors postulated that low fluid intake can cause supersaturation and crystallization of stone-forming chemicals, resulting in concentrated urine. More specifically, supersaturated urine is a condition whereby the urine consists of more crystal-forming substances such as calcium, oxalate, and uric acid. This excess of said substances results in the development of renal calculi, since the fluid in the urine would not be able to dilute substances properly. Also, nephrolithiasis may be manifested when urine is devoid of substances that prohibit crystal adhesions. Furthermore, the causative nature of nephrolithiasis is dependent on the type of renal stone developed. Kidney stones are formed mainly by calcium stones in the form of calcium oxalate or calcium phosphate. When there is an excess of oxalate produced by the liver or consumed through dietary habits such as the intake of too many nuts or chocolate, or when an individual have underlying metabolic conditions which promote phosphate, calcium stones can be formed. Struvite stones due to urinary tract infections, uric acid stones due to excessive fluid loss secondary to chronic diarrhea and malabsorption, and cystine stones due to cystinuria, a hereditary disorder whereby renal excretion of a specific amino acid occurs, can all contribute to an individual developing kidney stones. We will now hand over to our news anchor.
Thank you, Vashti, for that thorough explanation, and I do know our viewers have a great understanding of nephrolithiasis. Now, as we move forward, I will introduce you to student nurse LaFortune, a student at USC, the University of the Southern Caribbean, who would shed some light on the care plan nurses usually execute in intervening in this condition.
Thank you, Miss Aaron, and pleasant good night to all your viewers. From the case scenario discussed tonight, there are a few nursing diagnoses that did stand out throughout this case scenario, both actual and potential. However, before we dive into these diagnoses, we first must pay attention to the subjective and objective data obtained from the scenario. This would help us better understand or better tailor our care plan towards the needs of our patients. So for the subjective data, we have the acute pain, also the complaints of nausea and vomiting. For the objective data, however, we had the confirmation test of the kidney stones, which was a CT, together with the urinary analysis, which showed the urine to be cloudy and have a foul smell, together with the vital signs, where he had a temperature of 38.1, a pulse of 88, and a respiratory rate of 27, together with an SpO2 level of 98%. Seeing that we have now identified both our subjective and objective data, we can now proceed with planning an effective care plan geared towards our patient. Firstly, let's address the patient's pain. According to Nanda, the diagnosis for pain is acute pain related to. So let's draw it back to our case study. Acute pain related to renal pressure due to the large kidney stone in the upper urethra, as evidenced by the patient's complaint of a quaky pain in the left trunk. So we have both short-term and long-term goals for our patients next. Short-term goal will be that the patient will be able to verbalize a pain scale of less than 3 within 2 hours of nursing intervention. The long-term goal will be that the patient will experience significant pain relief and appear comfortable, physically comfortable during the hospital stay. So now we go on to our nursing interventions. These are the measures which nurses will take to ensure that this symptom is alleviated. So firstly, we have to provide the patient with back rubs as well as a warm compress. You may ask that, what is the reason for this? So back rubs can assist in reducing the tension within the urethral muscles and in turn soothe the patient's pain. The application of the warm compress can alleviate muscle tension and relieve the pain experienced by the patient. Secondly, we have to implement distraction therapy or techniques in the form of guided imagery or focused breathing. Muscle relaxation can be achieved through this therapy, as it will distract the patient from focusing on the pain and rather redirect their attention towards the breathing patterns and imagery. Thirdly, monitor and document the verbalization of patient's pain. This is an important step for nurses, as this will allow us to track the patient's progress and determine whether additional interventions must be included or if we are going on the correct track. Fourth, we have to administer prescribed painkillers as ordered by the physician. This medicine will alleviate the pain experienced by the patient. So moving on, we have our evaluation section. So we can put a time to it so that we could say within a day or within a few hours, the patient will verbalize that his pain is below 3 or 2 on the pain scale. And for a long term, the patient will maintain this level of significant pain decrease throughout the hospital stay and after. Within a nursing care plan, as I mentioned before, there are both actual and potential diagnoses. So for the potential diagnosis, this would be nursing diagnosis that has not yet happened, but the patient is at as great risk of developing this symptom. As such, nurses would put plans in place to avoid these symptoms from actually developing. So we have risk for infection related to bacterial colonization due to the complete occlusion of the urinary tract and urine retention. So, as we did before, we have our short-term goals. Patients' risk for urinary tract infection will be eliminated after 4 hours of nursing intervention. And our long-term goal will be that the patient will maintain adequate urine flow and will remain free from any risk of infection throughout hospital stay. Let's now discuss our interventions. Firstly, we have to monitor the patient for localized and systematic signs of infection. This is done because signs of cloudy urine, urine odor, or elevated temperatures are usually indicators of UTIs, and this should be monitored to determine the possibility of infection. Secondly, we have to encourage the patient to consume adequate amount of liquids daily. This is done to allow the patient to engage in an active urine output, therefore preventing the bacterial colonization via flush out. Thirdly, we have to conduct daily urine analysis. This diagnostic test would allow for close monitoring of the appearance and concentration and contents of the patient's urine and determine whether or not the patient is at risk for infection. Fourth, we have to administer prescribed antibiotics once the patient consents to doing the shockwave leg prospexy, which is the procedure used to remove the kidney stones. These antibiotics would assist in the removal of the renal stones and prevent the possible risk of developing urinary tract infections. This is in no way all the nursing diagnoses, both actual and potential, that can be developed from this scenario. However, these are just a few of the most relevant ones to this study. So thank you for having me tonight. It was a great pleasure.
Thank you, student nurse LaFortune, for shedding light on those interventions that nurses usually undertake, as well as the rationales. We truly do appreciate you, student nurses, and by extension the healthcare sector, as we combat and try to alleviate the effects of kidney stones or nephrolithiasis.
In conclusion, the therapeutic nurse-client relationship is the appropriate method of providing effective and meaningful nursing care. Generally speaking, the patient's diagnosis and prescribed plan of treatment is a key component in providing nursing care. However, the issue that should be first and foremost addressed in this case is the patient's concerns surrounding his hospitalization, as well as his impact it will have on his family. In addressing this issue, the nurse must build a plan of care on a framework that takes into account the psychodynamics of the patient. Thus, Peplau's interpersonal relation model is the ideal theoretical framework to apply to this case when developing an appropriate plan of care for this patient. Thus, Peplau's interpersonal relation model is the ideal theoretical framework to apply to this case when developing an appropriate plan of care for this patient. I'll now hand you over to our anchor. Back to you, Elena.
That's all for tonight. I am Elena Aaron, and this has been your Health Watch segment live at TV8 News.